got a smile so bright, you know you could have been a candle.
Hi, Mrs. Smith. It's nice to meet you. My name is Crystal. I'm going to be your nurse today. Hi, and you must be Jackson. Hi, Jackson. How old are you? 8 years old. You're all grown up. Well, Mrs. Smith, I was just reviewing Jackson's past medical history, and I understand Jackson has asthma. And it looks like he's currently taking an albuterol inhaler and a glucocorticoid inhaler.
Yes, he is.
Okay, so what exactly brings the two of you in today? Do you have any concerns about one of his medications?
Well, my friend recommended this herb called pine bark extract that's supposed to help with his asthma. Have you heard of it?
Yes, I've actually heard of that. But Mrs. Smith, before we go over the benefits of pine bark extract, I'd like to talk to you about the two medications Jackson is taking, so we know whether he could take the pine bark extract or not.
Okay, well, I have both of them here. Here's his albuterol inhaler,
Okay.
and here's his Q-bar.
Q-bar. Albuterol and Q-bar. Well, Mrs. Smith, has Dr. Brown gone over with you about the difference between the albuterol inhaler and the glucocorticoid inhaler?
Well, I know that he takes the glucocorticoid at the same time every day, and the albuterol during his asthma attacks.
That's right, Mrs. Smith, because his albuterol is a rapid-acting bronchodilator. So the doctor prescribed it as needed rather than on a fixed schedule, just in case Jackson needs to abort an ongoing asthma attack.
But how does that help him breathe?
Well, that's a good question, Mrs. Smith. The albuterol, the medication in here, it acts on the smooth muscles that surround your airway. And those are the same muscles that keep the airway open and prevent it from collapsing. I want you to picture a tent and the poles that hold up that tent. Now if the tent starts to collapse and it just starts to fall down because the poles are not holding up very well, then that's when the airways constrict. And that's what happens during his asthma attack. And so the medication helps by working on those smooth muscles, and it dilates them, making it easier for Jackson to breathe.
Okay. Well, if he has that, why does he need the other one?
Well, Mrs. Smith, albuterol is only a bronchodilator, but Jackson also needs an anti-inflammatory, because what do we know about asthma?
What?
Asthma is a combination of bronchoconstriction and inflammation. So we also need to give Jackson something to treat the inflammation.
And how do we do that?
That's another good question, Mrs. Smith. So the glucocorticoid, it suppresses inflammation. It stops the release of the inflammatory cells.
I don't quite understand.
Well, let's see. Have you ever had, a bug bite?
Yes, it was red and swollen.
Okay, well, I'd like you to imagine that's how Jackson's airway looks like when he's having an asthma attack. It's inflamed. It becomes swollen and red. And the glucocorticoid, it just stops that itching.
Okay.
Or the inflammation,
Okay, well, why does he have to take that one regularly and not the albuterol?
Well, Mrs. Smith, you don't want to stop taking the glucocorticoid out of the blue. You just can't. It's very dangerous for Jackson. Even decreasing the dosage for the glucocorticoid, it has to be done as a gradual process. So I want you to think of it like this. So imagine if we stop giving the medication suddenly and the organ hasn't returned yet from vacation. It's not ready to come back from its break yet. What's going to happen when Jackson experiences stress? For example, an asthma attack. There will be nothing there to suppress that inflammation. and that is called adrenal insufficiency.
Okay, I think I understand. So how about the pine bark?
Well, my colleague Gloria will be with you shortly. She's familiar with naturopathic medicine, and I'm sure she can explain that to you a lot better than I could. Okay, do you have any other questions for me?
Oh, that's it.
Okay. Bye, Mrs. Smith. Bye, Jackson.
Hello, Mrs. Smith. Nice meeting you. Nice meeting you too, Jackson. So I understand you're here to have a little talk to me about giving your son pine bark extract. Is that right?
Yes.
And I understand he's also taking albuterol and Q-bar.
Yes.
So you would like to start him on pine bark extract too?
Yeah, my friend's daughter started taking it and didn't need her inhaler anymore.
Well, that makes sense. Well, I'm gonna let you look at this book in here. Jackson was playing with it. So it is a book about a research that was done on pine bark extract and how it helps suppress the effects of asthma. And one of the effects it does is it actually helps reduce the inflammation that asthma causes and the asthma symptoms and awakening at night that Jackson might have. And pine bark, what it does, it boosts up our immune system. And as I told you, it reduces inflammation and it boosting our immune system. What pretty much does is increase it. It is like a natural antioxidant. Do you know what antioxidants is?
Well, I always hear they're in fruits and vegetables, but I don't know what that is.
Oh, you don't know what antioxidants is? So they're like superheroes in our bodies. Our body has like free radicals or free molecules that flow in our body that increase our tissue damage within our body and also have an effect on aging. And what antioxidants do, they chase against those free radicals.
Okay. I must have a lot of free radicals floating around then. I'm getting old.
Well, getting old is pretty natural and normal, but antioxidants stop those free radicals, and that's what actually boosts our immune system, and it makes our immune system stronger. So,
Okay,
any
so
questions?
yeah, is it okay to take with the albuterol inhaler?
It is okay, but remember that Jackson is not only taking the albuterol. You know, albuterol is for the vasoconstriction that happens. I understand the other nurse explained that to you. But it also needs an anti-inflammatory agent, which pine bark extract would work for it. But right now he's taking the Q-bar. So that medication suppresses the immune system the Q-bar is the one that suppresses the immune system from being overreactive. Now, taking the pine bark extract, what it's going to do is going to boost the immune system. So if you have the glucocorticoid putting your immune system down and the pine bark putting your immune system up, so it's just going to cancel out.
So what you're saying is the pine bark helps the albuterol, but it cancels the Q-bar.
Yes, that's right. So talk to your doctor. And in case the doctor recommends to take the glucocorticoid off and try on the pine bark extract, I would like you to pay attention to your kid and make sure that there are some side effects. Some of them include your kid might get very irritable, might feel some dizziness, lack of energy. They can have some gastrointestinal disturbances. Just make sure you pay attention to it because the research doesn't specify what kind of disturbances the kid might be feeling in their gut. Also, he might be getting headaches. And things that you must absolutely let us know is about mouth ulcers. Sometimes there have been reports of people getting mouth ulcers because of that. And sometimes hypersensitivity, that includes allergies. So if you see some allergic reaction on the kid, let us know. But that only if he gets started on pine bark extract. So I'm gonna have you see Anna, the other nurse, and she's gonna arrange your appointment with Dr. Brown. Okay?
So I just want to make sure that before we send you home today, you guys have an understanding of the medications and the pine bark extract. So could you tell me what the albuterol is for and when should Jackson take it?
Yes, his albuterol is used as needed and for his asthma attacks.
Good. So now can you tell me what the glucocorticoid is for and when he should take it?
It's also for his asthma to control the inflammation. He should keep taking it every day at the same time.
Good. So what about the pine bark extract? Do you know why you should hold off on the pine bark extract?
Yes, because it will cancel the effects of the glucocorticoid, and you don't want to do that because of that one thing the nurse was talking about.
Do you mean adrenaline insufficiency?
Yes, that.
Okay, so one more thing. Did you know what things you need to report to the doctor while Jackson is on this medication?
Yes, for albuterol, I want to report any changes in heart rate and rhythm, and if he's experiencing chest pain. For the glucocorticoid, I want to report if I see sores in his mouth and tongue.
Great. So here's the referral for the doctor. Please give us a call if you have any more questions.
Thank you.
The way you do the things you do.